Upbeat, informative intro music fades into the background. Hello everyone, and welcome back to the channel. What exactly is COVID-19? The name stands for Coronavirus Disease 2019, and it's an infectious disease caused by a virus called SARS-CoV-2. It first emerged in late 2019 and quickly spread across the globe, leading to a pandemic that reshaped our lives in ways we never imagined. Now, let's talk about the symptoms. For many people, it started with the most common signs: a fever, a persistent dry cough, and a deep sense of tiredness. Some also experienced a sore throat, headaches, or muscle aches. One of the most distinctive early symptoms was the sudden loss of taste or smell. It was a strange and unsettling experience for many. However, for others, the disease was far more severe. Serious cases often involve significant difficulty breathing, a feeling of pressure or pain in the chest, and dangerously low oxygen levels in the blood. In the most critical situations, this could lead to pneumonia, acute respiratory distress syndrome, and the need for intensive hospital care. It's this wide range of symptoms, from mild to life-threatening, that made the virus so unpredictable. So, how did it spread so fast? The primary mode of transmission is through respiratory droplets. When an infected person coughs, sneezes, talks, or even sings, they release tiny droplets containing the virus into the air. If you're nearby, you can inhale these droplets, and the virus can enter your system. Another way it spreads is through contact. If these droplets land on surfaces like doorknobs, countertops, or phones, the virus can survive there for a period of time. If you touch that contaminated surface and then touch your face, your eyes, nose, or mouth, you can transfer the virus into your body. This is why hand hygiene became so incredibly important. Finally, the environment plays a huge role. The risk of transmission is much higher in crowded indoor spaces, especially those with poor ventilation. In these settings, the virus-laden droplets can linger in the air for longer, increasing the chances of multiple people getting infected. This is why we saw so many guidelines about avoiding large gatherings and ensuring good airflow. Faced with this new threat, the world mobilized to find ways to protect ourselves. The most powerful tool in our arsenal became vaccination. Vaccines were developed in record time, and they have proven to be incredibly effective at preventing severe illness, hospitalization, and death. They work by training our immune system to recognize and fight off the virus without us having to get sick first. Alongside vaccination, other preventive measures became part of our daily routine. Wearing masks, especially in crowded indoor settings, helped to block those respiratory droplets from spreading. We all became experts, frequent hand washing with soap and water or using alcohol-based hand sanitizers when soap was unavailable. Maintaining social distance, or physical distancing, was another key strategy. By keeping a safe distance from others, we reduced the opportunity for the virus to jump from person to person. And as we learned more about airborne transmission, improving indoor ventilation by opening windows or using air purifiers became another important layer of protection. Combining all these strategies offered the best defense. But what happens if you do get sick? Treatment, COVID-19, depends heavily on the severity of the illness. For the majority of people with mild to moderate symptoms, the advice was simple: rest at home, stay well hydrated, and manage symptoms like fever and pain with over-the-counter medicines like paracetamol. It was all about supporting the body as it fought off the infection. However, for those with more severe cases who required hospitalization, the treatments were more intensive. Oxygen therapy was crucial for patients struggling to breathe and maintain oxygen levels. Doctors also used specific antiviral medications, like remdesivir, to help slow down the virus's replication in the body. Another important class of drugs used were corticosteroids, such as dexamethasone. These powerful anti-inflammatory drugs helped calm down the body's overactive immune response, which can cause significant damage to the lungs and other organs in severe cases. To combat the risk of blood clots, which were found to be a serious complication of COVID-19, anticoagulants or blood thinners were often administered. For the most critical patients, intensive care units, or ICUs, were the last line of defense. These patients often required mechanical ventilation to help them breathe. The care in the ICU was incredibly complex, focusing on supporting the body's vital functions while it battled the virus. It's important to remember that most people who got COVID-19 did recover, many without ever needing hospital treatment. However, the risk was not the same for everyone. Older adults and people with pre-existing medical conditions, such as heart or lung disease, diabetes, obesity, or a compromised immune system were at a much higher risk of developing severe illness. This is why protecting the most vulnerable in our communities was such a critical part of the global response. The pandemic highlighted our interconnectedness and the responsibility we all share for each other's health. And that brings us to today. While the pandemic phase has passed, the virus is still with us, and it continues to evolve. That brings up the topic of the latest vaccines and booster updates for 2025. The science is constantly advancing, and new vaccine formulations are being developed to target the latest variants of the virus. Public health agencies now recommend that people, especially those in high-risk groups, stay up to date with their vaccinations. The 2025 boosters are designed to provide broader protection against the strains that are currently circulating. The goal is to keep our immunity topped up, ensuring that if we do get infected, the illness is as mild as possible. It is always best to talk to your doctor or local health provider to understand what the latest recommendations are for you and your family. Staying informed is our best tool moving forward. Thank you so much for joining me today for this important look back and forward at COVID-19. It's a complex topic, and I hope this video helped clarify some key aspects of the virus and our response to it. If you found this information helpful, please give this video a thumbs up and consider subscribing to the channel for more content like this. Don't forget to hit that notification bell so you won't miss our next video. Stay safe, stay informed, and we'll see you in the next one.